Good morning. My name is Bolanle Ayodabo. My presentation is mammogram. Mammogram is very important thing in the life of the woman because it is used to diagnose the early cancer in breast cancer. The definition of a mammogram is an X-ray portrait of the breast to diagnose, evaluate, and follow people who have had breast cancer. That is, mammogram as a let the doctor to diagnose, evaluate, and follow people who have been had breast cancer. It's safe and reasonably accurate in mammogram. So it saves life. This procedure has been used for more than 50 years. The procedure has been used for more than 50 years. It is purpose of mammogram. A mammogram is used to look for early signs of breast cancer. That is, they are using it to look at if this person will have an early cancer so that they can eradicate it. Mammogram are the top test doctors use to find breast cancer early. Sometimes up to 3 years before it can be fed. But when a person will go for mammogram, they can detect it early and prevent it not to be happen. So it is important and good for mammogram to be done every year. We have a type of mammogram. We have conventional mammogram, we have digital mammogram, we have DRT mammogram. The conventional mammogram is create diagnostic images by applying a low-dose X-ray system to examine breasts. That is, they will use it to look at the images by applying a low dose of X-ray, not high, to examine the breast. The second type is digital. A digital chip to record images of the breast. This process also known as full-face digital mammography. This is a digital record images of the breast. The process also known as a full mammography. Then the third type of mammogram is 3D. Allow the breast to be filled in a series of layers, allowing the radiologist to more accurate interpret the images. So this one allows them to fill the series in layers. It also allows the radiologist to more accurate interpret the images. We have type of mammogram machine. We have a traditional, we have a digital, and we have a DT. These are the diagram of it. This is the diagram of the mammogram machine that they are using. The advantages of a mammogram. I said it in the beginning that mammogram have more importance, and it's very good, important for everybody to go and be doing it every year in order not to be a victim of cancer. Because the more they get it, the more they do it. So advantages of it is save life by finding breast cancer early, a reduction in the mortality from breast cancer in women. Many women treated for breast cancer keep their breasts. That is, it saves lives. Those are the three importance of it. Then the disadvantages of it is that the significant risk of mammogram is that they are not perfect. False negative, normal breast tissue can hide breast cancer. Will not show up on the mammogram. That is, it doesn't show on the breast. It hides under the breast tissue. Those are the disadvantages of it. Effect of false negative. Women are turned into patients. Mammography identified an abnormality, look like cancer but turn out to be normal. Those are the disadvantages of it. Then the disadvantages continue. We have a false positive. As we have a false negative, we have a false positive too. False positive leads to more tests and follow-up visits. It can be stressful. Surgery, another cancer treatment form. Quality of life and psychological well-being are adversely affected. That is, its quality of life and psychological well-being adversely affected. Then the false negative leads to normal breast tissue on high breast cancer. We will not show up on the mammogram. The significant risk of mammogram is that they are not perfect. So this the significance of a risk of it because they are not perfect. Recommendation. I recommend that every woman should be having a mammogram every year. It's a great deal of uncertainty surrounding it, but it is wise to go through the test before because it saves life. In every person, in every woman supposed to be doing it every year in order to save life. The higher they know, the higher they prevent the spread of the breast cancer. The references. These are my references. That is why I hope that this presentation, if you like it, it is important for every woman to go to the hospital every year to do the mammogram in order to prevent those to have a breast cancer. The risk of it, the higher they know it, the more they cure it. Thank you.